Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you for joining us once again and making us a part of your day. Going to have a conversation with Dr. Deborah Jones. She's a clinical scientist and member of the research team at the Center for Ocular Research and Education, or CORE. She's joining us on the program to discuss myopia, the global epidemic, and its impact, genetic and environmental factors that contribute to myopia, and control solutions for children. Thank you for joining us here on the program, Dr. Jones. Could you first explain to our listeners what myopia is exactly and what are some of the root causes of myopia?
So myopia, in simple terms, it's also called nearsightedness, and basically what it means is if you're myopic, you see things up close clearly and you don't see clearly in the distance.
So why are we seeing the rates of myopia increase so dramatically, especially in children?
That's an excellent question. We know that genetics play a factor, so if your parents are myopic, you're more likely to be myopic. But also with the increases we're seeing over the last few decades, we have to assume there's an environmental factor. So more time being spent on near activity, tablets, cell phones, as well as near work at school, and also less time being spent outside. We know that outside time has a protective effect for the onset of myopia, and children are spending less time outside and more of their social times inside.
So what can parents do to prevent myopia from developing or maybe advancing in their children's eyesight? Is there anything that can be done?
So if a parent, if the child has a risk of myopia, or even if they don't, they should be spending more time outside. So the recommendation is about 90 minutes a day. That will help prevent the onset of myopia. If a child is diagnosed as being myopic by an eye care practitioner, then the parent should have a conversation with that eye care practitioner about ways of slowing down the progression. We want to try and keep prescriptions in a low prescription range, and that will help prevent complications occurring later on in life that are associated with high prescriptions. We're very fortunate to have various options available to us to slow down the progression. There are drops, there are spectacle lenses, and there are also contact lenses. And actually here in Canada, we have a contact lens that has Health Canada approval and is indicated for slowing down the progression of myopia. And that's a product by a company called CooperVision, and it's called MySight. And that's a conversation that parents should have with their eye care practitioner to see if those options are suitable for their child.
So just how early should our children start seeing an eye specialist, and how often should they see that specialist?
The recommendation is that children are seen for their first eye examination at around about 6 months of age. That may seem a bit ridiculous because clearly they can't read the letter chart, but what we're looking at there is how the eyes are developing, are the eyes working together? And then we recommend around about the age of 3 prior to starting school, and then typically annually thereafter. Obviously, if a child is diagnosed with a problem, then the optometrist can recommend a different schedule for follow-up, but typically annually from starting school onwards.
So, doctor, what are some of the signs that a child's sight might be changing, that a child might be getting into a little bit of trouble?
Well, you may not actually get any signs. We said nearsighted means that somebody can see close very clearly and not so clearly in the distance, but a child may not actually realize they're not seeing well. You can look for signs of squinting or holding things close, but realistically, there's no substitute for an examination with an eye care practitioner.
Lots of really good information, Doctor. Where can our listeners go and get some more information about this topic?
There's lots of great resources available. There's a new website, fightmyopia.ca, that has lots of information that's really useful for parents and will also help them find an eye care practitioner if they don't have a family optometrist that they go to.
Dr. Jones, thank you so much for joining us here on Health Professional Radio. It's been a pleasure, and I'm hoping that you'll return.
You're very welcome.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to this podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.